Hi, What the Health Tech listeners. I'm your host this week, Mark Fewster, Chief Product Officer at Red Eye Healthcare. This is the podcast where we tackle some of the trending topics, ideas and best practices in health and social care. This week we sit down with Ellie Jordan, Account Director at Red Eye Healthcare, to discuss the latest enhancements to the Risk Register module. We'll explore the benefits these improvements bring to health and social care organisations, the customer-centric design process and best practices in risk management. Thanks for joining us this week, Ellie. So I've already introduced you. Do you want to just kind of give us a bit about your involvement in this project and the enhancement of the Risk Register module, please?
I can, thank you. I looked after the project from pretty much start to finish on the Risk Register development. So as the product owner, I was responsible for the requirements capture, prioritising what actually went into scope, what we couldn't cover in scope, and then prioritising how we developed it, the order of the development, right the way through to the end and the launch of the finished product.
Yeah, I think we're going to touch on that later on. I've got a next question for you, which is kind of, what do you think the importance of effective risk management is in health and social care? And how do you think what we've done now with the new risk register kind of addresses that?
So I think from the experience I've had as part of the beta and working with the different organisations, it's crucial to managing the safety of patients, residents, whoever the organisation is. And as an organisation, having oversight of actually what's going on and what needs to happen in order to kind of mitigate any risk. So it's not just about capturing that there is a risk, it's actually what are we doing about that risk and evidencing that and tracking that and how effective that is, you know, how assured are you that actually what we're putting in place is going to make a difference. And that's
So if we just touch on those couple of bits that you mentioned there, then I'm already going off topic, off script. So with the risk register then, and you kind of mentioned a couple of things there about kind of it's important to understand kind of controls and assurance. For how we've implemented the new version of our risk register, what would you kind of say were the key elements to it? And then how do those elements address those particular challenges? So maybe just start with, I don't know, kind of why Red Eye's risk register might be different to kind of other things out there. And then kind of underneath that, I guess, the bits you mentioned, kind of controls and assurances and that side of it.
Yeah, absolutely. So in terms of the development and kind of the enhancements that we've made, there are a few key things when we were doing the requirements capture that came to light. So one of them was the ability to approve a risk.
Yep.
So Red Eye Healthcare historically is, we've kind of led with the ethos that anyone should be able to report a risk to an organisation. Whether as an organisation they choose to kind of open it to anyone or not, that is completely down to each individual customer.
Yep.
But the way it's designed is that anyone could say, do you know what, I want to flag this as a risk to you. But the approval part of it comes in where actually I might not be experienced enough to recognise actually what the score of this particular risk is and all of the detail that goes behind that. So the approval allows for someone to record that there is a risk and submit it. The risk owner can go through and add all of the detail that they might want to. So that's including managing assurance. So being able to flag if it's a strategic risk or not, being able to say, what scope this risk sits at. Is it a local risk? Is it an organisation level risk and everything in between? How, what the levels of assurance are, any gaps in assurance, all of that side of things.
So just on the bit you touched on at the start then, so it's why do you think it's important for anyone to be able to create a risk in an organisation? Because I know my view would be 100%, you should let anybody who's kind of working for you as an organisation should have the ability to be able to flag something to you as an organisation. So you kind of mentioned the approval there and that having that step in place so that you can sense check it.
Yeah, essentially. Yeah, so the approval allows somebody to kind of like say, do you know what, you thought this broken window is a 25, but actually it's not, and so it allows for somebody to kind of rescore, acknowledge whether it is a risk or not, before it kind of goes into any board reports or the kind of the approved risk register. To answer your first question around the why it's important for anyone to be able to log a risk, I mean, this is my perspective, but if you've got a massive organisation, how on earth do you see what's going on the ground unless your people, your voice, and actually then being able to log things to you and raise things. It's the same principle as them being able to raise an incident or, raise any concerns or whistleblow or anything like that. If people are the voice of your organisation, then they should be able to submit that risk through. And the other way that people might do it is, they might say, they can raise it as an email and then the risk management team log it on Radar, which, that's a decision they can make. But actually, if you're using the system from the start, we've got the permissions in place and kind of the restrictions that actually it does open the doors for you to let people do it straight into radar.
Yeah, absolutely. And you mentioned scope there. Scope obviously kind of being a radar word for where that lives in the hierarchy, kind of location level, regional level, or organisation level. So you're right, people can just raise things into that system.
Yeah.
And I guess it depends on what type of organisation you are and how you manage your risk team. So you know through the beta we've got people who've got very centralised risk teams, and all they do is look at and manage risk. And then you've got people who've got completely decentralised risk, where they've kind of opened it up, for want of a better word, to others in the organisation. So I guess the approval is more for the central type, or which kind of...
I don't think we can generalise it and say it's based on kind of the setup. It's based on people's processes, I think, as well. So yeah, you're absolutely right. Like every organisation that I speak to about risk has a different way of doing it. It's, some are central, some are not. Some are like it's somebody's sole job. Some are it's just literally like one aspect of a massive kind of remit that they've got. And the approval, it isn't for everybody. So as we've been going through, some organisations are just like, we don't need that extra step. We don't want that extra step. So you're quite right. If they're managing the risk centrally anyway, then they probably don't need to approve it. So we can just switch that off. It's not something we're forcing people to go down. It's an optional kind of part of the process.
And you mentioned lots of different customers involved. So kind of one of the questions is around the beta process. And I know we touch on this when we do most webinars, to be fair, around product. But if we kind of cover off, because risk was probably a little bit different, wasn't it? Because from a product side, we were in a greenfield situation. So usually, again, for kind of people listening, when we're developing something, it tends to be greenfield if it's something that we're building brand new. So we kind of have a blank sheet of paper, and then in the nicest sense, it's easier to design something from nothing. Whereas in this case, you had a legacy system where you were constrained because of the thing that you already had. So walk us through that beta process and how that happened.
Yeah, no, 100%. So the beta process is, and we do this with all our product development, and we're really kind of customer-led when we're doing development. So we reach out to a range of customers. It's really important. It's not just one sector. We want to make sure that it's applicable to all of our different kind of partners. So we gather customers into a room, go through the requirements capture. So, take the existing functionality aside. In an ideal scenario, what do you need from risk management? Get all of those ideas out, and then from there we can start prioritising and going, okay, great, but what are your must-haves? What are the wheels on the car, and through to what's the sat nav? What are the must-haves through to what would you like in kind of if you could have a wish list.
Sat nav's a must for me, otherwise I'll get lost.
But that's the thing, isn't it? And that's kind of where different organisations will exactly say that, well, this is a must for me, and this is I'm not really bothered whether we have that or not. And approval is a case in point. Some organisations, it was a showstopper not having the approval process, whereas others are going to have it switched off. So, but yeah, it's really key to kind of gather all of that, all of those requirements through. And then we also had to balance that with the business needs. So actually, do we, as you said, go greenfield? Do we build from scratch like we've done with some of the other modules like audits, and actually recognise that that's going to be a much longer process? It's going to be much more in depth. We're talking probably a few years to deliver that. Or do we build on the existing and be able to kind of, we'd have restrictions on what we can do, what the capabilities are. So we were never going to be able to go full form builder and have people be able to customize all of their own forms like they can do in events and in audits. Yeah. But actually the compromise was, do you know what, but we can get some really powerful value out to you a lot quicker. And that's the route that we went down, and we had that consensus with the beta group. We involved customers all the way through the decision process.
Yeah, I think it's a really good point, isn't it? You want to get the value out there as soon as possible, rather than, like you say, waiting for however long to develop something that by the time you might deliver that value, the world might have changed.
Yeah.
So what you thought you were delivering a year, 2 years ago, and you develop in a way isn't necessarily what people want by the time it comes out. So being able to ship that value, get that product out early, I think that makes a big difference. I think again, obviously for this beta group, there was kind of more kind of public and private in terms of the types of different organisations in there as well. Yeah. And I think one thing I noticed was the very different methodologies across the different kind of sectors, for want of a better way of describing. So again, that's been a challenge, hasn't it? Of how do we get something that works for everyone? Because obviously we need a certain element of it needs to be generic in some cases because it's a piece of software. So you maybe want to just kind of touch on that in terms of the process for kind of how maybe we met those, because I know we've got kind of list of features and things to go, so things like board assurance frameworks and all that side of it. Yeah,
so board assurance framework is very NHS, and we had, in terms of the customers, like I said, like you've said, so we go from the small care groups right the way through to your massive acute NHS trusts, and actually being able to have a solution that works for everybody's been probably the biggest challenge in the whole process. So being able to balance as well the ability to have a certain level of customization to account for all of these different kind of the ways of working, but within the constraints of the existing risk register as it was. So we met in the middle with some of that, so we kind of compromised with being able to kind of show and hide different fields. We used some kind of custom lists, so whilst the field is there, actually you can populate what sits within there. Assurance, you mentioned board assurance framework, just a really simple change of name to just assurance makes it applicable to everybody. And then what goes within there as well, making sure that things are, optional in terms, instead of mandating that people fill everything in, having levels of permission behind it so that not everybody sees assurance if they don't need to capture it, if they don't have the expertise.
I think if we'll walk through kind of what feature-wise risk in a second there. I mean, I think what I was surprised about in the betas as well is just how manual a lot of this stuff was. And people had systems, but those systems were Excel. Or those systems were emails, and there wasn't kind of a real... Sometimes we displace a product, don't we? Like when we did audits, people have got an audit tool and you kind of go, well, what does it do and how does it work? Here it was, well, I've got this spreadsheet here and this spreadsheet here, and we've got this document here, and we do this email, and it was very manual.
Very manual. You're absolutely right.
Irrespective of the size of the organisation. Some of the bigger organisations we work with, it was kind of, you do this on Excel.
Or a single form, and it's not. So the examples that kind of people were showing were predominantly Excel, where you can do what you want. You can put whatever you want in there, and if you're an Excel whiz, you can do all sorts of fancy stuff, but it's still only an Excel document, and it's still very isolated from the rest of the system. And you can't track what people are doing in the same way you can in Radar. So taking something like like you said, the main kind of competition, if you like, is Excel. Taking something, the capabilities people have got in an Excel document into a system was a real challenge. But the real benefits of that are being able to standardise what's going in, being able to control what's going in, being able to track, the review of risk. So when are you reviewing it? How are you reviewing it? How are you scoring it? Who's doing it? What are you doing with the controls? Who's following up on the controls and adding all those updates? All of that you can't do in an Excel document in the same
Just explain
degree.
that bit to me then. So the kind of how a risk works in Radar, not necessarily all the detail, but just from a value point of view. How is a risk managed in Radar, and then how are the controls helping you manage that risk? And then I guess, how does it feed into the other parts of Radar? So we've got analytics, obviously, but you might have some events that are associated with the risk and audits and all that kind of good stuff. How does that kind of all come together into the risk register?
So in terms of the process for kind of the risk, and I won't go into too much detail, but somebody raises a risk, it can send an email off to the owner of that risk. So as we said at the start, it could be anyone in the organisation. It opens it up. So realistically, if you've got a spreadsheet, are you going to let anyone else have access to that spreadsheet? Probably not.
Or if you do, already you've got a risk now to go into your spreadsheet, and you've got a risk of your spreadsheet.
Exactly. So first of all, you're opening it up to anyone in the organisation straight away into the same system. So you might have done that by email or another means before. But straight into the same system. It's going to ping off notifications straight away to the owner. We can track people who are accountable and informed and consulted on these risks. So
we've got kind of that Lasky matrix, haven't we, in the background, where it's kind of going, here's the person who's actually, everything to do with Radar, who is on the hook for doing this and owning it, but then actually who else is interested in it. So again, kind of that NHS world might be kind of a directorate risk or a specialty level risk or something like that.
Yeah, absolutely. And alongside that, things that, like monitoring committee, who's actually monitoring this risk, so being able to capture that information as well. So once the risk is on there, I've already talked around the approval process, but it might be approved, it might not be approved. And then you've got that cyclical review process. So great, we've got the risk, we've logged it. What are we doing about it? And that's where your controls come in.
Yep.
So we can track, what controls are in place, the cost of those controls, who's responsible, when does that control need to be in place by, if it's a gap in a control, you can capture that. We capture that as kind of things that are outstanding. And again, you can put a due date and a cost and kind of against all of that.
Yeah.
And all of that being captured centrally, you can then start pulling through, like you said, into the analytics. So first of all, you can link different things to the risk. So if you've got a risk around infection control, then you can then start linking incidents that might take place or complaints that might take place.
It's
and
key
log
that, really.
in.
If I'm managing the risk, I've got some controls that are in place. Infection control, let's keep your example. And I've got a certain run rate of those, which are probably what's driving the risk in the first place. And then hopefully implementing these controls, and I can see what the impact is.
Yeah.
And then that can give me against each of the different controls what the assurance looks like. And then you can go back later on and say, well, actually, we were super happy with this control. We were assured that it was doing what it was, we thought it was doing, but actually now it's no longer having the impact we thought it was.
Yeah.
So it just becomes this cycle of reviewing your risk and really getting a clear idea of actually what's all the other things that are feeding into it as well. And not always radar data, to be fair, but if it is an event or if it is something that's in the system, it's easy to, the word triangulate everyone uses, but to triangulate that data.
Yeah, absolutely. So when you're pulling it through into the analytics, you can see, to your point, you can see the impact that any controls are making, and you're not having to do anything fancy in Excel and spend hours pulling that data together because Radar's just doing it for you. It's there, it's telling you what's happening, and straight away then you can start looking at, we can start looking at escalation of risk, and this risk was flagged as a strategic risk, and you can then start building out the different risk registers in your analytics according to kind of the committees or whether it's strategic or not. We've not talked about around objectives, but if you've got different strategic or business objectives, which risks link into those. There's a lot in it, is what
we're saying.
There's an awful lot in it. And this has been kind of the complexity of the project, is actually bringing all of this mass into something like the risk register it's been a really enjoyable challenge. It's been fun.
Yeah, I think ultimately, there's a question that I will ask you in a second about what you think the customers have thought the best features are. But for me, I think it is just that ability to be able to understand what impact you're having when you're managing these risks. So almost like just not forget the detail of it, because obviously you need to capture this stuff. But you've got, through the analytics and through the risk itself, where are gaps in my assurances? You've been saying where our targets have been met and people have not put any controls in place. So you've got all the operational sides covered, but the important bit of, fundamentally, are these things making a difference in some way, shape or form or not? Which is, back to the original point of what's the point of a risk register. Hopefully that's what we're doing. And then tying it into the other modules within Radar. So if you're using kind of events and you're looking at your learning dashboard and you can see you've got themes around, maybe training. Well, actually, have you got a risk around training, and you can start linking that together. You can start looking at, okay, well, now let's look at training as a risk, and we can start tracking that. We can use the pulses in the analytics to start, pinpointing what's happening and triggering different things in the background. So it's the benefit of pulling it into Radar is not just having the risk register itself in Radar, it's actually all the different things that surround it. 100%. Right, I'll get back onto the script now. Sorry, I went straight off onto loads of different questions. So we kind of touched on it. Which features do you think the customers have been the most impressed with? So obviously we've just raved about it for 5 minutes. Like we would? Yeah, you would hope so. What do you think people have been impressed with in terms of the things that they couldn't do before with the old version? So I think the approval side of things, which I know we've already talked around, but actually, especially those organisations who were using the risk register before the development. So we've had a mix in the beta group. So we had some people who are brand new to Radar and never used the older version, and they were waiting for this development. And then we had people who were on the older version and kind of had some challenges. So being able to kind of track and see what risks actually make it onto the risk register as approved risks. So that's been a really, really key feature. And then some of the assurance stuff as well, being able to track actually whether it's a strategic risk or not. Just because it's an organisation risk doesn't mean it's strategic, and being able to track against the objectives. But the key thing, I think, is the analytics. And I was going to say that. Sorry. The analytics, being able to kind of
track the trend of risk scores over time, being able to track escalation. So people have sometimes been a little bit blind, even if you're doing it in an Excel document, you know, how do you really track the escalation of risk, and how do you track any kind of alerts that go off the back of that, and being able to notify people. So escalation by score, escalation by scope as well, and kind of other changes within there.
And just, the amount of effort that goes into producing all those reports that people were doing and things like that, you just kind of got with all of that.
Yeah.
You know, it goes because you just use the analytics.
And it's such a small thing, but we did a webinar recently, like highlighting some of the analytics dashboards. And one of them was just like simply like the average target score versus the average score versus your target score. And actually that was just one chart where it was super easy to see. And like straight away, you've just got the data there, and in a visual, so you're not having to like kind of think too much about what you're looking at. You can straight away see, and like just really small things that you can do in the analytics that save so much.
That's a good example, because again, that's us learning from our customers, because that design came from one of our customers building out a dashboard on risk, and we were like, well, that's really great. Can we share that idea?
Yeah.
And then we've used it in our own dashboards.
Yeah, and that comes into like the partnership approach with all of this in all of our development, doesn't it?
Absolutely. Can you share any success stories or feedback from customers who have used the enhanced risk register module? You need to make it easier for me to say it.
So we've had really positive feedback actually throughout the whole process, because we've delivered kind of value drip fed. So some of the things we've kind of released all at once, like approval, but other things like improvements to the controls. So historically on our old risk register, adding controls en masse was quite long-winded, and like a really small change that we've done, being able to just like save and add another really quickly, it has made a massive impact. So that's such a small change that's made a really big impact. And then the analytics as well. They're some of the things that people are just kind of really chomping at the bit to get their hands on.
So I've got one. I'm going to have to read it off a piece of paper though, and hold it at arm's length.
I couldn't remember specific quotes. I'm sorry.
I haven't got my glasses on, so that's why I'm doing this. Even though somebody printed it out in huge letters for me as well. So I won't say it is who this is, but basically, since moving to Radar and introducing the risk register module, we've been able to have a much clearer handle on the management of our risks, utilising the analytics to provide oversight and identifying our response to risk. The risk review process is thorough but not time-consuming, and the ability to link risks to events within the system provides a great method of triangulation to support future risk reviews and to help inform whether risk scores and or responses should be changed. And then it goes on to say, some of the recent updates to the module have been helpful in supporting staff on the shop floor with understanding the requirements when logging a risk, and then looking forward to utilising the changes and everything else we're doing. So I think that's one of the ones that we're probably going to be using on the kind of marketing materials and things. But there's been a lot of positive feedback, hasn't there?
And the positive feedback's not just been from the development itself, but the process. So how involved and how listened to customers are, which I don't think they always get from kind of other organisations and other software companies. You know, they are genuinely listened to and genuinely have a voice, and we've kind of really been led by them.
I mean, otherwise we build the wrong thing.
Yeah.
You know, if you don't listen to the people who are going to use it, you build the wrong thing. So, difficult question for you. Can you offer some best practices in risk management that organisations can follow? So you're not a risk manager, but anything you can think of from kind of how to use Radar maybe?
So, I can talk from a kind of Radar product terms. So simplicity is always key in any of kind of, I think, any process, making sure, especially if you're involving the end user and you are one of these organisations that are letting anybody log risks. So best practices, making sure that you're kind of logging the updates in there. So with any actions or controls or anything like that, or tasks that you've got associated with risk, I can imagine it's very tempting to just be, it's not in place yet, I've not done it yet, so I'm not going to add any updates. But actually, we can add updates as we go through. And it does timestamp it. So if you've got a regulator walk through the door and they can see a particular risk, you're nowhere near your target, but actually you can evidence, well, this is what we've been doing about it, and these are the things that plan
to get us there.
Yeah,
absolutely.
And these are the things that maybe we've implemented so far, and you can then start tracking all of that. So that's one thing that I would say definitely. But utilising the kind of the different features. So we've got the ability to link, as we've talked around, the linking different risks to each other and linking the events to risk. So again, building that big picture. Don't be shy of doing that, because that really can then help with the reporting and measuring the impact.
Yeah, I think for me it's focus on the outcome, not the process. I think what I've seen in this beta especially, like there's so many processes, and whilst there is a standard definition of how to manage risk, which is kind of what we built our framework over, there are so many variants, let's call it, of that. And I think sometimes people are more focused on the process they've got rather than what they're actually trying to do with risk. What are you trying to do? Well, I'm trying to mitigate these risks, and I'm trying to make sure that I'm delivering back to our original point.
Yeah, safety.
Yeah, exactly. And so surely you want to focus on the outcome and not the process is important.
Yeah.
But actually the process is not the be all and end all.
And also terminology is another one that people kind of come unstuck around.
Lots of interchangeable words for the same thing.
Yeah, so inherent versus original and
controls and actions and
so the way we've built Radar, we had to go with one approach. So we've gone with controls. You can implement a control, and they're your implemented controls. And if it's not implemented, that's essentially a gap in the controls. Yeah. And that's the way we've gone, and that's the way and that saves time as well. So some people decide to use tasks for kind of things that are not in place yet instead of controls. But actually, if you go with how we've kind of designed it, it means that, first of all, you're tracking all of the progress of a control that is still a gap. It's not in place yet. You've got that outstanding. You can track all that progress, and when it is done, you can just mark it as done, and it goes straight into your implemented controls, and you don't have to duplicate any effort.
Yep, and then your analytics are there to see what difference you've
made. And you can reopen it if for any reason that control is no longer in place. You just reopen it and carry on. You've got the full history and audit trail.
Great. And then last question, what future developments or enhancements can we expect to see from Radar Healthcare? That's probably a question for me, actually, isn't it?
I can answer that, but you are probably best placed to answer that.
You have the first answer, and I'll answer it.
So with our product roadmap, so we, as we said at the start, the risk register, we decided to update the existing instead of starting from scratch. But one of the big pieces of work that we're looking to do as an organisation is moving onto our new framework. So that is essentially rebuilding each of the modules from scratch. That's going to open so many doors in terms of functionality, in terms of different things that have been suggested on our community and all of these different ideas that people have. Actually, it's going to give us a chance to go through and start implementing some of those that maybe we've been blocked on, just down to kind of some of the technical limitations, and then opening also the doors for further enhancements with the analytics. But I'll let you talk in more detail because you're going to be able to go into a lot more.
To be fair, that covers it. I think the bits that I would add to that would be part of the new framework for us is to try and build in some of the new capabilities that probably weren't even there kind of 2 to 3 years ago. So I know kind of, AI's been a buzzword for a long time, but kind of Gen AI is now the buzzword of, ChatGPT and all that kind of good stuff. We want to build out the new framework so we can take advantage of these technologies. So, for example, make it super easy for somebody to be able to fill in a form by actually pre-populating a load of information based on the description they've got, or automatically tagging things, or when a complaint comes in, automatically respond to that complaint without a person being involved. Our workflows at the moment are always manual in the sense of a human being's usually on the hook for doing something. So again, we want to look at kind of building in where can we do RPA, so kind of robotic process automation. Where can you automate some of those processes people do? But I think it always ends up in the analytics, really, doesn't it? And I think that's going to be and still is our focus for the development in the near to medium term.
And then how about things like self-service? Are there any kind of plans for?
Yeah, I think for customers at the moment, obviously there's some elements that they can't control themselves and they're reliant on us. Some of it's down to kind of workflows and things like that, where we maintain and configure those. So part of the framework, like we did with audits, if you think of what we're doing with audits, it's you never need to, it doesn't sound great, but you never need to speak to us, which kind of from a support point of view actually is a good thing. So it's that principle on the other modules, so they'll be able to change their own roles, notifications, do their own workflow configuration and things like that.
And I think it is a good thing for the customer because there's so many people that do need support and do want us to do it for them.
Speak to us for the right reasons. It's not just I need to make some small changes. You can do it yourself.
Yeah, 100%. Like you've got the autonomy if you need to do something, just you can.
Autonomy.
Yeah. No problem.
Great. Right.
Thank you very much.
No, thanks for joining us this week, Ellie, and thanks everybody for listening. Join us next time for another new episode. Don't forget to rate and subscribe. And if you have any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com.